Good Saturday morning to you, and welcome to the Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron. You can find her online at theburlingtondentist.com. I know, it's a sleep show, but she is a dentist. That's why it's theburlingtondentist.com out of Burlington, Connecticut. Look at that. I want to send her an email. You can do that really for two purposes. If you've got a question that you think other people would benefit hearing the answer to, you could just indicate that when you email her. Send it to drbrennerradio@gmail.com. It's BRENNER, drbrennerradio@gmail.com. Maybe we can get it answered as soon as next weekend's show. Or if it's something of more of a personal nature, just indicate that. So we don't want to mention anything on the air if it's with your name or anything too personal. If you would like to schedule a consultation, that's very easy to do. Something I strongly suggest, 860-673-7155. I'll say it again, 860-673-7155. By the way, I'll repeat those points of contact at least a couple more times before this show is over. Good morning.
Hi.
Nice to see you.
Yeah, you too.
What's new? Anything good?
Well, we're starting to get some people calling who want a free assessment.
Well, there we go.
I know.
Let's talk about that before we get into this morning's show, because I don't think we talked about it last week, but we did the week before. You've got something that's kind of cool that you're offering.
Well, we're going to do a half an hour of the free assessment. So you got to have the paperwork filled out, and everybody complains about my paperwork, and they're all like, "It's 18 pages," and I'm like,
"Whoa, 18 pages!
Wow.
Ain't nobody got time for that. That's a whole afternoon for me."
It does take a good half hour to
Can
fill
they
it out.
download it at home and bring it in?
We email it to them.
Oh, okay. That's
so
not
we
bad.
do that.
Sitting in some office all
No. They takes them a while to fill it out because the questions are important, and then they all are like, "This is a pain in the neck," and I said, "I know it's a pain in the neck, but you know what? I read every question and I read every answer."
Oh, that's good.
Yeah, because this helps me get to the crux of the issue more quickly.
All right.
So that's why don't complain about my forms.
Well,
they're important.
As long as I'm not walking in and having to fill out 3 hours worth of forms.
No, we give it to you in advance.
All right,
yeah,
that's
we
fine.
email it to them. Yeah.
I'd be scared for a minute there.
Yeah.
Okay, so that's good.
Yeah.
So keep going. So they fill out this form.
Right. And so then we'll sit down and we'll go over the form and we'll see what we can find. I'm sure people are curious whether they have sleep apnea or signs of it. Mm-hmm. And you remember I've always said I'm like Sherlock Holmes. I have to go through the medical and the dental information. So they have symptoms or signs, and we ask about that. We also ask, and one of the questions that they get often confused by is, what are your top 4 complaints? And we want them to number them. Number 1, number 2, number 3, number 4. And the reason for that is some people come in and it's like, yeah, I just have jaw pain. We've talked about that. I have some people, it's like, oh, I've got headaches. I got migraines every day. Okay. I'm tired. Oh, I have ear problems. Okay. So the jaw joint's very close to the ear canal. So those are some of the things I see. Tiredness, waking up frequently during the night. Those are some of the other things as well. But they have to give me a priority list. Okay. Because some people come in and they check off a ton of boxes and like really what's bothering you the most. Now, I often get neck or back pain. And I say the state of Connecticut doesn't let me treat you for necks and backs. But it's important that I understand that that's a problem. Why is that? We've talked about this.
Yeah.
Because of the forward posture of their head, right? So when you're carrying this big, heavy bowling ball and you're in front of your shoulders and you're bent over because your neck is forward, that's to open up the airway, but the cervical spine gets crooked to do that, right? So now you're like looking like you got your chin stuck out. And I look at their body postures, and people don't even realize how crooked they are. And this affects the whole body. So we look at children all the way up to your 90-something years old, yeah.
So is going back to the original thing, so there's 4 questions, or there's 4 symptoms, or people
No, just
have
priorities.
questions about, okay.
Yeah.
How often do you hear, I'm waking up my wife or my husband because women get sleep apnea,
that was exactly what happened this week because I had a wife that came in. I saw her on one day and I saw the husband the next day, and she's snoring, but not too badly, and he's snoring. So I look in his
Canceling
mouth
each other out?
a
Or?
little bit. So, I'm talking to both of them. They both should probably have a sleep screening, a sleep test of some kind. So, but one of the things that I look at is I look at the back of their throat, right? How much of an air hole do they have? And so neither one of them can breathe easily through their nose. And that's another aspect, okay? People often, and I would have told you I breathed fine when I started this whole thing. And I started this like 18 years ago. So when I tell you that I sat in my first course and the guy goes, yeah, these people can't breathe through their nose. I'm like, I can breathe fine. I'm sitting here. I'm not having to keep my mouth open to breathe, right? But some people do. And so when he tested the nose, I was like, oh my gosh, I have that too.
Right.
So I volunteered to do a sleep test for the class so they could put it up and look at the sleep test,
Nice.
right? So I do this home sleep test at the time. I had belts, it had a computer that sat in the middle, and thing went down my arm, and I had to tape all this stuff up underneath my nose and around my ears and tape it on my face. I had a full-blown panic attack when I did that. I had treated patients with panic attacks. I'd never had one. And I'm like, what? And I'm walking around the hotel room, talking to myself, going, okay, you can do this. Just lay down and go to sleep. And I was like really struggling with this. I did sleep. I was a terrible night of sleep for me. And yet, when I took all this stuff off, and you should have seen me. I was like ripping it all off and putting it in. I was like, I don't want to deal with this thing. And I'm bungling it up. I feel like a Bill Murray commercial,
Right.
I'm going like that. I put it in the box and give it back to her. Well, she said, oh, you did great. I said, wow, it was a terrible night of sleep. She goes, oh, you slept 7 hours. I wouldn't have told you that I slept 7 hours. And I feel like I woke up every hour. And she goes, oh, no, you have moderate sleep apnea. I was like, what? So when you don't breathe well through your nose, believe it or not, because we get the people who come in and they can't do their dental x-rays, it's because their nose is not clear enough. So recently I had a little boy who's 8 years old who we tested, and he had severe sleep apnea. So we were able to get a cone beam of his head, Mom and I, because we're starting to work him up for treatment. He cannot breathe through one whole side of his nose. It's completely occluded with stuff. And he had been to see the ENT, and they were like, well, his tonsils are a little enlarged. Did they even think that this kid might need some kind of a cone beam CT scan of his head? No. So I said to Mom, take a picture of this with your camera, and now you're going to show this to the ENT, because you're going to go back and have a conversation with this guy. Because this child won't blow his nose. Now you know why. He's got some issues, and they need to suck that out of his sinuses. So, I can still work with him and help him, but there's a main reason why he can't breathe through his nose.
First of all, when you, I don't even know what it's like to get 7 hours of sleep. Weekday, weekend, obviously. Look, we're bright. So there's something that, are there different types of, it sounds like there's different types of sleep apnea.
Yes, there are. So you get the obstructive sleep apnea. That's where you obviously stop breathing. Typically, you're on your back.
That's
your
scary.
Your jaw falls back. Well, it doesn't have to be for long, because we get partial and we get full, okay? So the reason I say this is because if it's under 10 seconds, they don't count it as a sleep apneic event. They count it as a partial, which is called a hypopnea. And then you get the ones where you're not breathing. So I see anywhere from 20, 30 seconds up to a minute, and I've seen as much as 90 seconds. They stop breathing. Now the brain, that doesn't like that, to not have any oxygen.
Yeah.
And that's a big stressor on the heart, because the heart's trying to like going, oh shit, it's speeding up, because the brain's saying, circulate the oxygen more because I'm out of oxygen, okay? Well, eventually, obviously they were sitting in my chair, so they came out of it, right? I said, well, you're still alive, that's why you're here. But that kind of an event, sometimes they wake up to a gasp, okay? I've had people who wake up after that particular event, and they sit bolt right up in bed, and they have to go sit in a chair. They're like wide awake. They're like, the adrenaline, the cortisol levels are sky high, right? So those are usually my moderate to severe guys, okay? And when they describe these events, they can't go back to sleep. Their heart's pounding. They're like jazzed up. So they either go watch TV, they try to sit in a recliner, they can't lay back down in bed. It's very, very upsetting to the system because it's like, oh my God, you nearly died. Now, those are the same guys that start to have trouble going to sleep. Why do they have trouble going to sleep? So I sit there and I go, because your brain's going, don't go to sleep because you're going to die. Don't go to sleep because you're going to die. I just had that event last night. So, but eventually they fall asleep. Now, I have some people that can't wear those CPAP machines at all because they get so claustrophobic on their face with these masks. And the sleep physicians don't seem to have another solution for them. So for some, they can do some nasal surgeries if they've got polyps and cysts and things that are clogging up the nose path, if you will.
Oh, boy.
Some people, they don't have any of that. And so they think it's the deviated septum. But I have a lot of people with deviated septums that don't have that issue.
Deviated septums, you can tell, they sound different. They sound like they have a permanent cold, right? They sound congested.
Not necessarily. Not necessarily. Those are the ones that have. So goes back to nasal hygiene. Now, we've talked a little bit about this at other shows. So nasal hygiene means how are we controlling the mucus that's in the nose? Because it's there for a reason, right? It's want to wash out the viruses, the bacteria, the mold that we snarf up our nose, right? Mm-hmm. So when I see somebody who can't control that, and I recently had a paramedic who is like, I just got off this cruise and I've got a tooth problem. And now he's blaming it on the dentist that did his crown a month ago. And I took an x-ray and I'm like, sinuses is all clogged up. And I said, well, let's take a better picture of your sinus. So we did a CT scan. He was clogged. I said, no, this is a sinus infection. I'm not allowed to treat that, okay? So I said, I will, make an appointment with an ENT or your primary care, but in the interim, flush your nose. Now, flushing the nose, nobody likes to do, not even me. It's a very unusual and weird sensation in the face when you do that. Does it work? Oh, hell, yes, it does, okay? So when we can hydrate the mucus and get it to basically flow out of our nose, okay, we clear it up. And all the third world countries, they don't have antibiotics. They flush their noses in order to get rid of sinus infections. Don't think we're the only country that ever gets a sinus infection. It's all around the world. So, and Dr. Oz pointed that out. Oh my God, my mother was a fan of him way back when.
I still like him.
Oh no, he's a good guy.
Yeah.
But he talked about, so she had recorded this one show, she wanted me to see it, where he used the Navage.
Oh yeah, that big. Yeah, we've talked about that in the past.
Oh my gosh, it was so funny. The look on his face.
But it's big. It's awkward.
Well, and it's the pressure, and you could see his eyeballs get real big around it. He was like, couldn't wait to get that off his nose.
Bet.
But you have to wait till it cycles, right? You can't stop it.
I didn't know that.
Cycle. Oh my gosh, it was so funny to me. So one of the things that I highly recommend to people is called a Sinupulse, and I like the travel version. They have a big machine, looks like a water pick thing you can put on your counter. You don't need anything that big. But when you flush the nose, you want to flush it with the right stuff. So I tell people there's a product that looks like Xlear when you spell it. It's pronounced clear. It's a Scandinavian product. But it comes prepackaged, so you don't have to measure anything. You just tear open the package, you put it in a cup of distilled water, and you can put it in this thing, and it will help flush your nose. So as I tell people, you got to start doing it several times a day. And the reason you do that is because you hydrate a layer of that mucus that's all dried up and like gunky in there. And then you want to hydrate it and flush it through. So you got to do one side, then you got to do the other side, and you repeat. So you want to blow your nose every time you get through because you'll get some of that mucus out. Okay? So when you do it again, now you're hydrating another layer of that mucus. So it takes a few times, but usually in 2 to 3 days you can flush a lot of that stuff out of your nose. And so I had people doing that all through COVID. Nobody got COVID. They never got COVID.
Wow, incredible.
Everybody who was using the Clear product did not get COVID. So the family did. Their whole families did, but they didn't.
They didn't.
So it's very interesting, right? So we have It's interesting how things work, right? So I used to say to people, when you go to the store, and you should do it always, and you've heard me say this, when you go out in public in the wintertime and there's like illnesses like colds and flus out there, do not breathe through your mouth. You will suck that right into your lungs. You'll suck that right back to the tonsillar area, and you will get a cold and you'll get the flu. Breathe only through your nose. Okay? You don't have to wear a mask. Just don't open your mouth and breathe. Okay? But try to do that for people who can't breathe through their nose, right? They're already like, I can't do that.
Right. Yeah.
So it becomes hard, right? So it's flushing the nose. It's not a natural thing. I get it. Everybody hates it, but it works really well.
Yeah, it's so fascinating. I can't afford to get a flu or a cold.
And I'm rarely sick because as soon as
I rarely keep my mouth closed.
Well, that's probably true. But when I get a little postnasal drip, even for myself, I immediately flush my nose.
Well, of course. What are some of the more common symptoms that people talk about?
Well, snoring is the number one thing.
I meant other than that. You're right.
Well, they wake up with headaches.
Okay.
That's a real common one. And why is that? Because they're not getting enough oxygen. They're desaturating during these apneic events. Okay? Oh, to go back to your original question, sorry, I should have said this before. So we have obstructive sleep apnea. We also have central sleep apnea. So central sleep apnea is when the brain doesn't tell you to breathe.
Oh.
You sort of forget one or two.
That's
what
dangerous.
causes some of that? So we don't know exactly, but we think it can be medication driven. The people who tend to take something like a Tylenol PM, or maybe they're taking Xanax or Zoloft or some kind of antidepressant medication, sometimes they will have central sleep apneas. I have people with heart issues. Some of them will do it. Some people who get on, and this is a rare thing, but they call it complex sleep apnea, and because they put them on a CPAP machine, and these guys have more central sleep apneic events than they did prior to going on these machines. We don't quite understand how that all works together. At least I don't. I'm not trained in that. So that's where hopefully the sleep physicians can figure some of that out. But we do get some of those. Mostly it's medications, because I have people who are really sick. Mm-hmm. They're on 10 to 15 medications when they come to see me sometimes. So, but headaches is a big one because they're oxygen desaturating. One of the things I like when I see a sleep test is I want to see what we call the RDI value, their respiratory distress, okay, which some of the sleep tests do not test for. Okay, so I get really weirded out because I, as a dentist, I can't help them. I'm not a sleep physician. I'm not going to put them on a CPAP machine. That's not part of my
What about
option.
their balance? Would balance have something?
So you can get people who have chemical changes in the body. Okay, so we know that some people who start to get dementia sometimes have balance issues. Think of our elderly. If you have inner ear issues, which is often I get ear pain with people with sleep apnea. Some of them have balance issues because of the fluids in the ear. That's part of why we get vertigo.
Okay.
But
let me do something really quick here. Just a quick ID, folks. You are listening to The Sleep Show along with Dr. Bethaney Brenner. I'm Gary Byron. You can find her online at theburlingtondentist.com. And she's ready to take your phone calls in less than 10 minutes. 860-673-7155. I'm going to repeat all of that more towards the end of the show. Here's another one for you. What are some of the risk factors?
Well, obviously, number one comes to mind is obesity.
Yeah.
People who are heavy, they tend to put a lot of weight on the back of the tongue area and on the neck area. So one of the things, we talked about this when we were talking about the CDL licenses, they're actually measuring the size of their neck, and then they're saying you need a sleep test, okay? In order for these guys to stay driving a truck, they're going to have to watch their weight in order to keep their jobs, because the state of Connecticut is now getting really concerned. Why? Because their reaction time while they're driving changes when they're sleep deprived. Okay? Some people, And unfortunately, I hear this from certain individuals. They can find a time where the buddy will keep an eye out for them and they can take a nap. Okay? And that's kind of sad that people need to take a nap while they're at work. Just saying.
What about smoking? Would that impact it?
Smoking impacts it a different way. So there's your lung capacity, okay? It's an irritant to the nose as well. There's cancer chemicals that are going into your body, so there's a toxicity factor here. So we kind of look at, we know the elderly tend to get more sleep apnea than children do, but children get sleep apnea. We know more men will see sleep apnea more quickly. Once women hit menopause, we see them skyrocket into sleep apnea. If you drink alcohol, we all know that you're never going to sleep as well, okay? And you can count on it. And when I was out with my girlfriend a couple of weeks ago, I think I mentioned last weekend that we went to the Outback. So we each had one glass of alcohol. And actually, I got myself a Cosmo.
Yeah, look at you.
Yeah, I like it. Well, they're fun. I don't drink it very often, but we both knew we were going to screw up our sleep. That sure as shooting it did. But, you don't do it every day, so it's fun. And I think part of that is you need the social time because that's good for the soul. And so do I do it every night? No. But there are people who believe in drinking every night, and they do that, and they have their drink. And down in Florida, it starts at 4 o'clock in the afternoon, and those people drink until whatever. And I personally feel like that's an issue.
What about age in itself?
So yes, so when you get what we call muscle laxity, one of the reasons why we droop, hate to say it,
Right.
the muscles get weaker. They're not as firm. They don't hold your airway in the same position. When you lay on your back, now the jaw falls back and that airway can close up. Now, one of the things that creates more sleep apnea is a dry mouth. So I have people that come in and it's like I'm getting gum disease or I'm getting tooth decay and I see that they're wearing on their teeth and stuff. One of the things, right? One of the things that we find is that they have a real dry mouth. So when the tissues get dry, and I actually have a little test that I do that can definitely prove that. But when they lay back on their back and their jaw falls back and the tissues get closer together, now if you're dry, you stick. And you stick for longer. You don't come apart as quickly. And that creates the apneic event.
There's got to be complications.
Well, think about what sleep apnea does, right? So we see people with more heart disease, high blood pressure, diabetes. So those complicate things. So think about the weight that you put on. And I like to tell the guys, before you see a little tummy, right, it's already putting it on the back of your throat. And that's another reason why neck size becomes kind of one of those things that we look at. Is it a die-hard thing? I get skinny people that have sleep apnea too. Do they structurally have a narrower airway? So we have some people who are born with narrower airways. And I had a woman that had come down from Boston, and I sent her to an ENT that I know up in Boston who's really more airway centered. And Peter saw her, and he's like, I can't do anything for her structurally. She's just super narrow. That's going to be a problem. And not always does the CPAP keep them open. So we need to sometimes do a combination of things. We'll use a sleep device and the CPAP together. So we are kind of helping to keep the airway open, but we're also propping the airway open. That's really what the nighttime device does. It helps prop the airway open. And since I have a computer program that I can test to make sure I'm driving you into parasympathetic so you get good night's sleep, I know that I can do that, and I prove that. If I cannot, then we're looking for other things.
What about like irregular heartbeats and things like that?
So once again, every time you're stressing the heart
or heart disease in general.
Well, that's why when you stop breathing, you're stressing the heart.
Right.
The heart has to speed up.
That can't
right?
help. Yeah.
So it's kind of like, and you're doing this at odd times, and how many times an hour are you doing it? Okay, so when you're stressing the heart all the time, and I have some people when I see their sleep tests come back, it's like, oh my God, the heart rate variability is really crazy on those tests. These are things that are stressors for the heart. So we tend to see The blood pressure sometimes goes up because they've gained weight, right? And they've gained the weight because their blood sugar is out of control, and they're eating the same way, but it's not calories in, calories out. That's a real misnomer. And a lot of people think that. So I see these heavy women that are out jogging and they're trying to do something because they know they need to lose weight, but that's not the way it's going to come off. It's really hormone driven. And so until you start understanding how the hormones work in the body, we believed the Biggest Losers, okay, because they drove those people crazy with exercise. Did they drop the weight? The answer is yes, but they gained it all back.
It's a lifestyle change.
It has to be a lifestyle change.
You're going to lose more weight from the kitchen than from the gym, I would imagine.
Yes, you do. And you lose it more effectively and with less stress on your nervous system, if you will.
Sure, that makes
because people are like driven crazy. La, la, la. So I go based on what do we need to do overall, all right? And I get a lot of young people who are not overweight, and they have pretty bad sleep apnea. So it's like, what is causing the issue? So we need to keep looking at all those factors. So I always want a primary care physician involved because we want to know how healthy you are, what's going on. Sometimes it's an ENT, sometimes it's an additional sleep physician. But sleep physicians poo-poo me. Not all of them, but the ones that I work with I understand where they're coming from. I don't step on their toes, and they help me get people into an appliance that helps them. And then we have several different ways of treating sleep apnea. That the physicians only have one thing, and it's called a CPAP machine.
There's some other solutions than a CPAP
I don't
machine.
think they don't have that.
Well, they don't say that, but you know. And
Well,
from
I know
doing this
that-
show, I've learned that there's other.
Right, there's other things.
We're under a minute to go. Now would be a great time as we're wrapping things up here to give Dr. Bethaney Brenner a phone call. If you've got a question or concern, a comment, maybe something we can get answered as soon as next weekend's show. Or if you had a personal question that you'd like to ask to Dr. Bethaney Brenner, why don't you zip her over an email, send it to drbrennerradio@gmail.com, BRENNER. So her office is in Burlington, Connecticut. You can go online to our website, theburlingtondentist.com. More importantly, write this phone number down and call it today, right now, this weekend. During the week, just call her. There's what she was offering earlier, this sleep assessment, complimentary. This is incredible. 860-673-7155. One more time, it's 860-673-7155. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next weekend, have a good one, everybody. So long.